And it's go time. What's going on, everybody? Darien here from The Third Eye, an insight into higher living, where you can find truths about your health, about your fitness, about your mindset, and all different types of tools that you can apply to your life to make it more enjoyable, powerful, happy, and healthy. So, today's episode is an interview with the Dr. Miles Nichols. He is one of the founding doctors for Medicine with Heart, a functional medicine clinic that is very far set apart from others. So, we are going to be diving into why every single person on the planet basically should be applying the Wim Hof Method to their lives every single day. So, especially during these times right now, we need the help. Alright? Much love. Enjoy this episode. And don't forget to subscribe. Peace. Hello everyone, Darien here with The Third Eye. I'm here with Dr. Miles Nichols, one of the main doctors for Medicine with Heart clinic that I have been recently working for. And we're both together today to talk about something that is very dear to my heart. It's been helping me a lot with my path, and I've recently found out that Dr. Miles has been a part of the same endeavor and adding this tool set to his tool belt. And so we decided to get together and to talk about some of the science and testimonials of ourselves so that we could hopefully add a different perspective to this method that we're going to be mainly talking about today, which is the Wim Hof Method. I guess a good way to start it off is to basically, if you could, Dr. Miles, explain to everybody what the Wim Hof Method is.
Sure. So the Wim Hof Method is a three-part method involving breath work, cold exposure, and mindset. And I have been, of course, passionate about and interested in for a long time helping people with health and with overcoming issues, both not only physically but also mentally, emotionally, spiritually. And so I am very aware of and interested in things, especially things that have come up on the map with some research behind them, things like meditation practices, and in particular, the Wim Hof Method is one thing that's specifically been researched to help with certain things. And because I'm a functional medicine doctor and work with clients with chronic diseases, I like to have as many things as I can to help people, to empower them to do things on their own. And that's one of the real values to this particular system, is at least parts of it are pretty easy for people to do on their own. So the three parts, again, are breath work and cold exposure and mindset.
Okay, perfect. That was beautiful. And it was already touching my heart.
Good.
So I guess it makes sense to break them up into each set and go over each one. So I guess if we could start with the breath work, and you could explain why Wim has added that into his three pillars.
Yeah, so the breath work in the Wim Hof Method is a certain style of breathing, and that style of breathing has enabled, in part, I believe, Wim to do things that have been extraordinary. So he has many, many world records, and he's done things that other people have thought are impossible. And the whole method, the three parts, are together what he's done in order to be able to do extraordinary things. And in terms of breath work in general, there's a ton of different traditions that utilize breath work in one way or another. Going back thousands and thousands of years, breath's been used, conscious breath control or breath awareness or different techniques and styles of breathing have been used for spiritual reasons, for health reasons, for emotional reasons, and we also know and understand in medicine that certain pathologies or certain issues that come up for people are related to breathing. So if people are breathing too shallowly and quickly, we see that when someone's having an anxiety attack, for example. And so breathing can be associated with physiology, and there are many, many practices that have integrated breath work as a part of their traditions in order to help shift and change physiology, shift and change emotion and or mood, and to connect with something greater as well, a feeling of being at peace, a feeling of having the worries and concerns of life fall away is another thing that can happen sometimes with certain styles of breath work.
Right. Yeah, I myself personally have been doing the breath basically every single day for the last month or so, really because I was having such need for it, and it was through the different stressors of certain aspects of my life personally, and then the situation that our whole planet has been going through right now, which is really a big part of why I was so compelled to make this interview with you happen, so that we could really build a set of understanding from evidences and our testimonials personally, because I feel like one of the main things that is going on right now is like the most powerful thing a person could do is to stay calm. When we're calm, we're more powerful. When I'm more calm, I'm more able to think of a solution in a pinch, in a bind. But when I start getting worked up and start feeling like a form of panic inside of myself, I just don't make the best decisions. I don't talk to people the same way, and it seems to agitate the situation more. And I know from my own personal studies that blood flow is flowing to different areas of the brain, and I'm sure you could talk about it even more extensively than I can. But what my research has shown and told me is that our immune system shuts down when we're anxious, especially over like longer periods of time. And blood flow to different areas of the brain is like the frontal lobe, I think it is like being diverted to other areas that are more fight or flight, so you're not even thinking with the same level of cognition to solve the problems that you're being faced with right now. So I think that is one of the most powerful ones that I feel whenever I'm finished. This morning I just had a stressful morning for different reasons, and I did the breath, and then there was just this wave of relaxation and calm, and then it changed the direction of my day and my ability to handle my day. So I really love that part, and I do think that it's the most powerful part that I've personally experienced so far.
Yeah, and with breath work in general, it's a part of our physiology that we can consciously control. It's normally not under conscious control. It's part of the nervous system, and breathing happens, and that's a good thing. If you don't think about breathing, you want that to happen.
Right.
And so, but it is unlike the heartbeat or the flow of blood or some of the other autonomic processes like the digestive process. Unlike those, you can consciously, almost everyone can consciously step in and do something with their breath work. And it turns out, as we'll I'm sure get into a little later, that controlling that breath work then can actually be a gateway into controlling other parts of the autonomic nervous system. But I think it's important at this point to bring up a concept called hormetic stress, because I know you're saying that it feels like you've shifted into a more relaxed state. You're talking about anxiety, you're talking about how when you have had a stressful day like this morning, that doing the breath work was able to help you to get into more of a relaxed state. Interestingly, if we look at the research on breath, this particular breath work, the Wim Hof Method, it actually stimulates the sympathetic part of the nervous system.
Which is like the relaxed.
No. Parasympathetic is the relaxed.
Okay.
This breath work actually stimulates the sympathetic part of the immune system, of the nervous system, which you'll actually see in research that it spikes adrenaline. Adrenaline actually goes up. So epinephrine or adrenaline are adrenal hormones that get high when you're threatened or when you're under extreme stress. So if your life is in danger, that rush, if someone cuts you off in traffic, that rush as you're slamming on the brakes in your body, that feeling is that adrenaline or epinephrine flowing through. So it's important actually to think about and understand that this breath work is a stress on the body. But it's what's called a hormetic stress. Hormetic stressors are things that they're a short-term, some level of stress that allows for your body to get stronger or better afterwards. It's like
almost like working out, or
like lifting weights would be an example of hormetic stress on the muscles, because you're stressing those muscles
in a controlled environment.
Yeah, you're maybe even breaking muscle fibers, flooding the area with lactic acid, but your body responds, and it responds that, we need more muscle, and it builds and strengthens that muscle in that area. So this is actually very similar for the stress response. It's temporarily inducing what's called a hormetic stress response, so that you're becoming more adaptable and flexible to be able to have stress and then come back down from that stress. So it's almost as if that stress response that you're inducing is a temporary stress response that then you go back into a relaxed state afterwards, and it allows for your physiology to be able to better withstand stress. It's building the stress muscle. It's building that resilience in the face of stress or challenge, because let's face it, stress isn't going away.
Yeah.
Especially now in the world, we're going to see that people have a lot of stress for various reasons. And yes, of course, if you can control, if there's a stress that's something that you can easily control, great, but stress elimination only gets you so far when life throws curveballs. So stress resilience, cultivating the ability to be able to stay calm and centered in the face of stress. So if you were to give yourself a small dose of a controlled stress every day in a way that was allowing your physiology to come up and then back down quickly, that's the adaptive stress response. The healthy stress response is you come up and you come back down quickly. The problem is when you go up and you stay there. That's a real problem. And we see chronically elevated cortisol levels in some patients who have issues with stress and anxiety. They often will get into this chronically elevated state, and sometimes they'll burn out and then get into this chronically deficient state. And either way, an adaptive response of bringing up and down, up and down, up and down is helping those adrenal glands, those hormones, that HPA axis between the communication between the brain and the adrenals and the stress response and how people respond to stress in the world. Training that response to healthfully go up and back down. If you get cut off, you should have adrenaline flowing through your system so that you can respond quickly.
Right.
And then, once that threat is gone, you should come right back down. Quickly.
Yeah.
And that's a healthy stress response. The problem is when someone gets cut off, they get that stress response and then they're jitters for the rest of the day. They're jacked.
Right.
And they have a hard time coming down.
It's funny that that I've been so called to do this work personally, and what I found out recently from Andrea is my girlfriend, who also works here. She's the manager for the clinic. She studied a lot of material who Anthony Williams explains a lot of the stuff about the adrenal, and I've recently found out that I burnt my adrenals. I burnt my adrenals out because I was living off of coffee to stay up, and then I was also not implementing really healthy types of stress, I guess you could say adaptive responses or stress, healthy stress exercises or things in my life, like different types of teas or meditation or the Shengzhen, which you recently taught me, which I really want to do another interview with you in the future on. Different healthy practices to keep the stress down in a healthy way. So basically, I learned that I was also eating not food for a long period of time, which was making my adrenaline come in to basically feed me, to like feed that epinephrine jolt, would feed me to keep me running. So my adrenals were just going and going and going and going. And it was making it harder and harder and harder the longer that I was in that state for so many years to be able to have a healthy stress response. So because of that, that's one of the reasons why this has been helping me so much. And one thing that you said piqued me was the cortisol. When we're stressed out, the cortisol is flooding, right? And the cortisol comes in, which is very healthy, but if it stays there, it's basically creating a lot of acidity within our body. And one of the things that I found is that the Wim Hof Method instantly, within the first three rounds, that 15 or 10 minutes that you're doing it kicks you into a completely alkaline state for hours. And I don't know of how long they know, but he said it was over 3 hours. So for over 3 hours, we're in an alkaline state, which is part of the reason why I think it's helping that that relaxation and that calming effect, because the cortisol is being, I guess, counteracted. So that's another aspect of it, because I know that there's so many different things, because science is being built around this. We're learning all the different aspects that are going on. So yeah, that is a lot about the breath work, the power of the breath.
Just want to bring in another point, which is that, just in case people don't understand, cortisol is released by the adrenal glands, and cortisol is associated with stress and anxiety. But cortisol is also associated with certain beneficial anti-inflammatory effects. It's pro-inflammatory in certain ways, it's anti-inflammatory in other ways. It's very complex, but basically the brain has the hypothalamus and pituitary glands, and it's the brain that tells the adrenals how much cortisol and how much epinephrine or adrenaline, which are the same thing, epinephrine and adrenaline, the same thing, cortisol different. So cortisol is a hormone that's a little more prolonged. Adrenaline usually goes up and down pretty quick. Cortisol goes up and takes a little bit longer to go back down. And that cortisol response is healthfully every single day. In the morning it gets higher, at night it gets lower. It actually helps people wake up in the morning and get going, and it gets low at night so people can fall asleep. There are many issues that can happen with cortisol and or adrenaline production. People can get what's called sympathetic dominant, where the sympathetic part of the nervous system is activated more of the time than that parasympathetic rest and digest part. There's also issues where people can get into rhythm problems, where the cortisol is too low in the morning or too high at night. And those are rhythm problems with the circadian rhythm every day, that people should normally have a healthy morning cortisol response to wake them up and get them going, and then at night have a relaxed cortisol response to allow them to fall asleep at night. And so there's rhythm issues. There's also blood sugar related issues, where cortisol can, when people have too low of blood sugar, cortisol can go up to try and bring the blood sugar levels up. So there can be blood sugar dysregulations. And then if there's inflammation, cortisol can go up to try to combat some of that inflammation. But again, if that's chronic, that can become a problem in the short term. It can be a healthy adaptive response. And with alkalinity versus acidity, that's a very complex conversation. The blood itself is always alkaline. It's always above 7 pH, which means it's in that alkaline range.
Right.
It has a very narrow window in that alkaline range, and it really only changes very, very little. Now, with the breath work, it does go up in alkalinity a little bit. It was alkaline before. You start breathing because, unless you're in an acidosis state, which most people aren't, most people's blood is already alkaline. It gets a little more alkaline when doing the breath work. And that does, in research, have the capacity to detach pain receptors. So there are proteins that attach to pain receptors that signal pain in the body. And there is some research showing you can actually break up those pain receptors. We don't know for how long, but you can break up those pain receptors. People who are in chronic pain, may be able to, for a period of a certain amount of time post doing the breathing exercise and alkalizing their blood, they may, for a period of time, be able to have reduction in pain. That is something, though, that we don't know how long that lasts exactly. It may just be a couple hours, it may be 5 hours. We don't know exactly how long that lasts in terms of a research-based perspective. But it is also important to note that 2 alkaline is a problem too. Respiratory alkalosis, again, this is an adaptive response, go up and come back down. If people who do go into those anxious states will sometimes bring themselves into respiratory alkalosis for too long, and that is a problem as well. So the body is very good at regulating its physiology, and then there's parts of the body that should be acidic. The stomach should be very acidic, and if people don't have enough acid in the stomach, that's a big problem. Essential amino acids, these are important things for our body. The intestines generally should be a little bit acidic. The bile should be very alkaline. So it's different parts of the body. So it's a very nuanced, complicated discussion. But we do know that alkalizing the blood temporarily in the short run may help with chronic pain. And it is a part of what happens with the Wim Hof Method breathing portion of it.
It's interesting that you brought up the pain receptor breaking apart in that way and being affected in that state, because in the amounts of the cold therapy that we're going to get into next are something that I've noticed is my ability to handle what was previously painful to me. The pain response adapts and changes, and there's a certain point in time where I stop feeling cold, I stop feeling painful or pain. So there's something going on with our body's ability to be able to adapt in that way that I am finding very interesting, because you're sitting here shivering and thinking that this is not where you need to be and this is bad for you, and we're told that we should stay out of the cold and that it's going to make us sick and all these different things. And I'm sure, like you're saying, there's so many nuances to it. So it's not a flat out conversation, but there's a reason why it's in the 3 pillars. And what I've noticed is that after I'm in the cold for a certain period of time, maybe 30, 45 seconds, maybe even a minute, it's like all of a sudden, all those pain receptors drop, and I fall into a very calm state while I'm sitting here in like almost freezing water, And I see this happening with different people. So it's very interesting, that pain receptor aspect of it. But I guess if you think we can start getting into the reasons why the cold therapy has been a strong aspect into the Wim Hof Method.
Sure, absolutely. So the cold therapy is one of the other pillars, and there's some research on cold therapy, specifically looking at what cold therapy does. And I know we're going to come back to the breathing and some of the research, more specific research on the breathing too, which actually has quite a bit. But cold therapy has been also researched. It very clearly raises norepinephrine, which is the same as noradrenaline. So there's adrenaline and noradrenaline, or epinephrine and norepinephrine. And they're similar. They're both released or secreted by the adrenal glands. They're both involved in that sympathetic stress response. The norepinephrine is strongly released immediately on cold exposures. Very quickly, a lot of norepinephrine is released because that norepinephrine is involved, at least in part, in activating what's called brown fat. There's white fat and brown fat, and most of the fat that's considered to be problematic for people's health if you accumulate too much of it. So with obesity, we know that heart disease risk goes up, diabetes risk goes up, risk for various illnesses go up significantly with obesity, and that's due to adipose tissue, which is another name for fat, accumulating on the body. But that is what's called white fat. Brown fat is a different kind of fat, which is still adipose tissue. It's the same tissue, but the difference is it has really high concentrations of something called mitochondria.
Oh, wow.
So some fat in the body doesn't have much mitochondria in it. That can be actually a problem for health, especially around the organs, like visceral fat is a big problem. But brown fat is fat that has a lot of mitochondria concentration in that fat. Mitochondria are these powerhouses for cells. They're these organisms that release energy. They make ATP. They're how our body gets cellular energy. And they're highly concentrated in brown fat. So our metabolism, our metabolic function, how much calories, for example, that we burn when we're just sitting doing nothing, that metabolic function has to do deeply with the mitochondria and the energy production, and the norepinephrine stimulation from cold exposure stimulates the mitochondria in fat to start to reproduce. It's called biogenesis. It's that mitochondria is realizing that, we need more of us here in this fat in order to produce enough metabolic heat to stay warm. So it's this, again, adaptive stress response, where, again, the body is subjected to a stressor, and then that stress response says, hey, we need more of these mitochondria in the fat to produce the heat to keep the core organs warm enough. Now, to be clear, there can absolutely be too much cold, and that can lead to hypothermia. That's a serious medical condition, and cold can absolutely be a big problem, which is why the Wim Hof Method, it's never force, never go, more than a person feels like they can reasonably tolerate and have some ability to get warm again, and if needed, especially if people get too cold. So it has to be done well under training, ideally with someone who knows what they're doing in order for it to be safe. But if it's done safely, then there is immense benefit to that cold exposure. Again, a hormetic stress response stimulating norepinephrine, stimulating mitochondrial biogenesis in the fat, and brown fat production, converting some of that fat into brown fat by stimulating those mitochondria. And mitochondrial dysfunction is related to a lot of diseases. The list for the number of diseases that have mitochondrial dysfunction as part of them is going up and up and up. Recently, Parkinson's disease was just found to have a strong mitochondrial dysfunction component to it. So mitochondria being able to, and the function declines as people age, and that's part of where the aging process is leading people to have lesser ability to be adaptive to stressors is through mitochondrial dysfunction. So exercise is fantastic for mitochondrial biogenesis, and it appears that cold exposure is as well. So that's, in terms of what is good for mitochondria, exercise and cold exposure are very clearly good for mitochondria. There's a little bit of research on low oxygen also being a hormetic stressor for mitochondria, and a couple other things as well that people take supplementally or do with their lives that can stimulate mitochondrial function. But that's one of the big parts for the cold exposure.
What's really interesting about that is that the oxygen is obviously being boosted and modulated by the breathing. So it makes so much sense for them to be connected in the same system. You have the one that's boosting the ADP through the mitochondrial, through the cold therapy, and then you have also the mitochondria, if I heard you right, being fed by the boost of oxygen?
Actually, there's interestingly research that mitochondrial function improves dramatically in low oxygen environments. So this is very new research, and it's not yet fully fleshed out, but there's mouse models where they're depriving mice of oxygen, putting them in low oxygen environments, as if they were up at, maybe 15, 20,000 feet elevation. The levels of oxygen that you might find at those much, much higher elevations, and they're improving dramatically. The mitochondrial function is improving dramatically. The breath work, in terms of oxygen, is very complicated and a little bit confusing, because the oxygen levels go up in the beginning of doing the breath work, but they go dramatically down towards the end of doing the breath work, and then the CO2 levels go down, and then they build back up, and it's complicated to understand because there's blood oxygen and there's tissue oxygen, and as the breathing is happening, it's very difficult to understand how much of that oxygen is built up in the blood. But for people who do wear a pulse ox as they're doing the breathing, which is looking at blood oxygen levels, not tissue oxygen levels, they are noticing that they will have the oxygen saturation may go up a little at the beginning, but then it goes dramatically down with the breath work. And so exactly what's happening with that oxygen, where it's going, what's happening as the breath work is being undergone is, I don't think, as far as I'm aware, fully fleshed out or understood. There probably needs to be more research into tissue oxygen versus blood oxygen, but it clearly, especially with the retention, the oxygen can drop very low temporarily.
Right.
To a level that you wouldn't want to see again, these short stressors, to a level you wouldn't want to see long term, but then it goes back up. And I have had a couple of patients who've been working with the breath work who notice that their average oxygen saturation level goes up when they're doing the breath work regularly. And I don't know that there's any research, that's just anecdotal. So that would be something that I'd like to see some research on, is if people are exercising their oxygen exchange systems, is that going to improve their function? I don't know, but that's a good question.
Okay, so we've hit the breath, the oxygen, the lack of oxygen, and we've also hit the cold, and now we have the mindset, the mentality, the third pillar. So why is this one so important to Wim that it has been added into the method?
Well, mindset is obviously a critical part of going into the cold for a lot of people, because that's a difficult experience. So it's already needed in order to do that part of the method. And it's also clear that the mind has such incredible capacities. One of the studies that was done with Wim was looking at whether he could warm his skin. He was put in an MRI machine and put in a suit that has cold water running through the suit, and he was unable, because the images wouldn't come out clear if he was doing certain movements to boost his metabolism, or even
breathing, right?
Even intense breathing, which breathing in the cold like breathing in water don't mix, but just because people can get lightheaded and dizzy, it's just a safety issue. But anyway, the breathing, he couldn't do a lot of breathing, he couldn't do a lot of movement, and so he had to warm his body with his mind primarily, and activating his mind, and was able to show when he wasn't, it was very interesting, when he wasn't doing the method, skin temperature got warmer and colder like everyone else. But then when he was able to use the mindset part of the method, then his temperature stayed higher the whole time, even when cold water was going over.
While he wasn't doing the method.
Well, he wasn't doing the mindset part of the method.
Right.
And
he wasn't doing the breathing of the method.
Not during. Before, maybe, to prime his system, but during, he wasn't able to be doing that. So during the experiment, he was able to, using his mind and mindset, keep his body temperature warmer, which is showing that there's the ability to control parts of the autonomic nervous system, like temperature regulation, consciously. So things like the amygdala, which is a part of the brain that regulates fear and the fear response. And there's a good part to fear, and there's a bad part to fear. There's healthy fear that helps people make good choices, and there's unhealthy fear that gets perpetuated that can lead to dysfunction and problems. But that amygdala, again, is part of that subconscious or unconscious response that isn't controlled by people, and if it gets out of context and people start to be excessively afraid or anxious or depressed, then having some ability to consciously impact and influence and control things like the amygdala in the brain would be incredibly useful, and has been thought to not be possible for a long time. But the beginnings of the research on the Wim Hof Method are showing that it may be possible and trainable to control parts of the autonomic nervous response.
It's really an empowering concept, and it fills me with a lot of hope, because I just want to continue to empower myself in all different types of situations and challenges that I face in my life. And the one that just always comes to my mind that I think is so worth sharing is the placebo and the nocebo. So you have, in all different types of medical studies and research experiments, what's always accounted for is a person's ability to believe if they are being administered with something that is actually not what they're being administered, like a sugar pill or a fake surgery, that they received the cut to convince them and convince their mind, and then they heal their knee. Their body gets healed, and they never went to surgery, or at least they just got a cut to trick their mind into it, and then the body responds in suit. So I think that it's something that makes so much sense to me personally, and also just from a logical place of like this huge aspect of science that has been built over so many years, which is the placebo, people's bodies healing itself, or the nocebo, where people's bodies where people's mindset and their belief is making them sick. So it's definitely popping up in different ways that are very scientifically valid and very well researched,
Yeah, I mean, placebo and nocebo, I train other practitioners. I have a functional medicine certification program through the Medicine with Heart Institute, and we train other practitioners about how to do functional medicine, and I give a talk in that program about placebo and nocebo and some of the research on those, and how ideally practitioners should be trained on what the research said. Ted Kapchuk out of Harvard has done some amazing research on placebo effect and given people open label placebos where they know it's a placebo but they're taking it, and studying the result of those, and it's been incredible the results that he's found giving people placebos that they know are placebos, and it still gets a better response than the blind placebo part of a study on a similar topic. So they did irritable bowel syndrome, IBS, digestive issues, and found that the open label placebo did better than the placebo control arm of a drug study. So it's very interesting that if a person is in the active group of something happening, like even being given a sugar pill or a pill full of air, that if they're active and they know that's the active treatment and they have that intention, there is some power there, and that's of course it's used in research as the thing to test against, but it would behoove practitioners, especially doctors out there, to get a better handle and understanding on how placebo works and how nocebo works, so that we're not, because doctors are required to say side effects for medications, for example, and if they do it in a way that induces a negative nocebo effect, then that's a problem.
Yeah.
Because they're not required to say all the good things that could happen, right? And so, if it's important, it's for a reason that the side effects are said, but could those in the training program we teach doctors and clinicians how to say the side effects in a way that's less congruent, so they're less likely to induce them, and then talk about the potential positive effects in a way that's more congruent to be more likely to induce them, but not also to be sure not to promise things that can't be guaranteed. So it's a very delicate conversation for how do we communicate in a way that maximizes placebo but minimizes nocebo and simultaneously doesn't give false promises. It's a very delicate way of communicating, so we cover that for practitioners and clinicians. That being said, going back to the method here, the mindset piece is one that is important. We know that meditation practice, from a research-based perspective, improves immune function, helps decrease depression and anxiety, helps improve focus and concentration, reduces cardiovascular disease risk, the number one killer today, and the research goes on and on and on. If there was a pill that could do that, that had no side effects and that was free to take, everyone would take it. So many people would take that pill that improves your immune system and gives you a better mood and helps you to be more focused and productive and get more done and less worried and concerned about the issues in life, and that sometimes gives you inspiration and creativity flow, and the side effect is nothing. The side effect is that you feel good for no reason some of the time. I mean, that's an amazing pill that I think everyone would take, and meditation is free, and people can do it on their own at home. It is that pill, but it's in a different form, and it does take some training, some practice, and some time. And I really hope that through some of the stressful situations in the world, today and throughout time, that people really start to take seriously and realize the importance of mindset, meditation practice, and understanding that there is the ability to focus, center, ground, calm internally. There is the ability to find inside, I believe, there's the ability to find inside each and every one of ourselves a place that's untouched by any stress, any trauma, any issue that's ever happened, a place that is completely loving and profoundly caring. And you'll see that, for people who watch interviews with Wim Hof, he'll talk about love at points, that the deepest lessons that he learns from nature, from cold, from the breath work is love. And you look at other systems like the Shungjen meditation system that we mentioned briefly, the core of that is embodying a state of unconditional love. And you'll look at many, many different people who've had near-death experiences who come back and talk about unconditional love. So I believe that there's a mindset piece of finding a place within ourselves that is completely whole. No matter what's happening externally, the world could be having crisis, and we could find still a place that is caring and loving regardless of circumstances. We don't have to have happiness be dependent on what's happening in our lives. There is the capacity and the ability to have a sense of peace that really doesn't depend at all on what's happening in life. And that, I think, is the core of that mindset principle, is how can people arrive at that place, access that place, go back to that place when they're a little bit feeling like, gosh, today was a stressful day, there was a lot that happened, okay, how do I go back to that part of me that's whole, that part of me that's still connected with love? And that builds a fundamental resilience in the face of stress, challenge, struggle, traumatic experiences, if there's that internal resource that people can build. And it's not about any specific external thing, it's completely internal. And that's the biggest part that means that it can be done anywhere at any time, and there's no restriction on that. So that I believe to be the core of that mindset principle.
It's beautiful. It's beautiful. It really, I was in that space. I felt it. You took me there. Yeah, there's two different things that came to my mind during that really eloquent way that you laid out all those different elements. And one of them ties into the mindset, which is something that I've been studying and working with myself, is something called seeking discomfort. And it's a concept that basically says all of the things that are truly important to us lie on the other side of discomfort. Like if we have a crush on a girl, if we want this job promotion and we're going to have to push ourselves into a position that is outside of our comfort zone, which feels all nice and comfy, which is also what happens when we have to push ourselves into the cold, right? So what I've noticed for myself, and I've been hearing from other people, and through my own studies and through my own experience, what I've been understanding about what has held me back in my life previously is my inability to push myself out of my comfort zone at different times and walk up to the girl who I had a massive crush on and talk to her so that we could go out on a date, and that so I could fill my life with so much happiness with this person that I know is a good fit for me, but I have to push myself out of my comfort zone. And so there's another YouTube channel called Yes Theory, which I recommend everybody to go check out. It's their slogan. It's called Seeking Discomfort. And so something that I've noticed is that fear response is something, and Will Smith also says this. He's such an inspiration to me personally because he has done so many incredible things, and he says it over and over and over. He says that we have to change our relationship with fear and with discomfort. And they actually did one together, and they challenged him to go on a bungee jump out of a helicopter, and it scared him, so he went and did it. And it was this huge testament of his ability to push himself through discomforts. And so often people go skydiving and they'll be scared until they jump out, and then they say it's one of the top, most incredible, most satisfying experiences that they've ever had in their whole life. And so that's what I've noticed is also a little muscle that's being worked, because I have to get in that shower and I have to crank that thing down to the cold, and I know it's going to be uncomfortable for a certain period of time. And so now I can push myself farther and deeper into those places, which is where my dreams lie, which is where my happiness lies. And obviously I'm not saying don't have a normal fear response to a fire or a car crash or things that are survivalistic or necessary and important, but this is a nuanced aspect of really getting the lives that we want and experiencing more joy, more meaning in our lives by chasing the things that lie on the other side of our comfort zone.
Probably comfort is one of the biggest enemies to people overcoming chronic health concerns, overcoming issues in their life, because, doing the same thing over and over again and expecting different results, of course, is, one of those sayings that is prolific, because what's comfortable is almost by definition what's been done in the past. People are comfortable with what's familiar. And change almost inevitably has some discomfort because it's not familiar. So comfort really is about what's been done in the past. Change is about doing something differently, and change is associated with growth. And so within mindset, there's the belief, the mindset belief, and then there's commitment. The mindset belief is I can, the commitment is I do. And so having both, the ability to believe that you can go into the cold, I can go into the cold, and then the commitment I do go into the cold. Or I can change my diet, I do change my diet. Or I can adopt an exercise plan that's going to be helpful for my health, I do that. Or I can have a meditation practice, and then I do meditate every day. These are the kinds of things that mindset principle can lead towards habits that change for the better. And comfort or familiarity can get in the way of that if people are too attached to that comfort and what's familiar. It's great to have some things that are regular things, and it's good to also be willing and able and courageous enough to make some changes. And so those changes are going to be uncomfortable, but that discomfort is, if people can get used to that, or even enjoy a little bit that uncomfort, that discomfort or uncomfortable feeling, that they could start to change their relationship with that feeling. Right. And changing their relationship with that feeling could enable or allow for them to change patterns, behaviors, ways of relating with other people, ways of relating with themselves. That's going to be the most important. And for me, I don't believe that it's a problem to have fear or anxiety or anything like that. It's about how do I relate to that, and then how do I respond. And if I relate to that as valuable information and I respond consciously with that information as well as other information, and I surround that with love and profound care, and I go ahead and do what I know needs to be done anyway, what I know in my heart I need to do to offer to the world, then that emotion of fear or discomfort is good information, but it doesn't stop me from following my dreams, following my heart. So that's something that I think that if people can start to understand a little bit about how they can have the mindset to change their relationship to the uncomfort or the discomfort or uncomfortability with making change, that can enable people to start to think about it in a different way and maybe actually get to doing some of the changes that they put off in the past.
Yeah, it's holding all of us back in different ways, and it's just about adopting a new set of skills, like we all have to do at all different points of our weeks and months and years of our life forever. We're always having to adopt new levels of ourselves. And I really love that love part, and it reminded me, my second piece, that I really feel like is really worth mentioning here, and it's that you had mentioned the love, and finding that love within your heart and within the depths of who you are, and finding that stillness and that space where you're not being blown by the wind and blown by the challenge and really being taken out by the different stressors that are happening around you. There's a power and a need and an ability for all of us to find that stillness within ourselves, that grounded center where we don't allow that space to become chaotic or disturbed. And what I feel like a reason that is so important, and a reason why that is within us, within our physiology, and within us all, it's built in, I feel, is because from that point of love, when we can love every situation in our life, we're seeing the positive inside of it, and what that is doing is we're extracting the value out of everything. And we're not saying that it's okay, we're not agreeing with it, we're not supporting it, but what we're doing is, from a grounded, centered, stable place, we're learning from the breakup that was so intense in different ways, or from the illness that we were having to face in a way that was forcing us to change certain aspects of our lifestyle. And when we can have gratitude for this thing that on the surface may not seem like it's valuable, but it truly is just fraught with value. What I like to consider that as being like an alchemist of life, because you're extracting and transmuting something that is negative, but really it's valuable. Really, you are now gaining so much insight and clarity so that doesn't happen to you again in the future or in your next relationship or 5 years down the road. You're going to be a stronger, better person for you, your family, your job, and for your pets, and for any type of situation, and ultimately for the world. You know, I think right now there's so many things to be scared of, unprecedented things that we've never been faced with, but there's value there. There's a value because we're coming together, we're learning how to be more clean, and we're learning how to face different levels of adversity, and that's something that I just think is innate within the human experience and what we're going to be faced with in the future. So I really think that is something that I am trying to cultivate more and more within myself, and so that I can be someone who extracts the value out of all situations.
Yeah, absolutely. There are plenty of problems in the world, plenty of things that are happening that are despicable things. That being said, connecting with love isn't supporting or agreeing with those things. Connecting with this sense of love is realizing, hey, we're one human family. You know, we're all inhabiting this earth, and we're all part of this bigger universe, and there's something amazing no matter what difficult issue is happening in life, my life, or the world today. I can still appreciate the beauty of the universe and connect with that greater feeling and connect in with my own heart and my own inner stillness and find out what inside wants to come forward. And maybe that is to start an organization to save the whales because I see that problem. Maybe it is to, in my case, it is to help to end the chronic disease epidemic. With the Centers for Disease Control saying 6 in 10 Americans have at least one chronic disease. To me, that hurts inside. To know that 60% of Americans have at least one chronic disease, 40% of Americans have 2 or more chronic diseases. That's a problem. That's a huge problem. And so I see that as a problem. Connecting for me with that love energy is inspiring me to have enough of a focus on that there is also this amazing universe, that we're all living in this human family, this earth, that I can focus on channeling my energy to do my part as best I can on helping to reverse that chronic disease epidemic. And so I can offer videos like this, I can do interviews, I can work with people one-on-one, I can do practitioner training so that other practitioners and doctors and clinicians know some of this information to be able to treat their clients and practitioner and their clients and patients better, and help do our part towards reversing the chronic health issues as well as the systems problems that are in the medical system and other areas that are preventing practitioners from having the tools and the ability to help people. And so, that's a whole nother conversation, but it, for me, is just important to recognize that we can be seeing problems and wanting to take action to solve those problems while simultaneously accepting and embracing and leaning into what is. That acceptance of what is doesn't mean we agree with it, like you said. It means that we're staying calm, centered, and grounded, and focusing our attention, focusing our energy and effort on what's in my heart, what can I do, how can I help? How can I help humanity, how can I help the earth? And that sort of attitude, I believe, it gets, for me personally, it gets me out of thinking too much about this, that, or the other problem in my own life. Gosh, I just had this weird interaction with a friend. Those things seem smaller when I'm connected with a bigger mission, a bigger purpose, a bigger vision. And so I think that bigger vision is something that I'd like to help people to understand and connect with, because for me, it matters little, the small things in life, the disagreement with, someone that I had doesn't matter so much, the issue, the financial issue, whatever issue comes up, it doesn't matter so much when I'm connected to something bigger, like the universe, humanity, the earth, that incredible love in my heart. That is something that makes other things, other problems seem small in comparison. And they're still there, and my job is to relate to them from love as best I can, and to work on them from a place of caring as best I can.
I think it's truly pragmatic, It's just the practical way to handle it best. At least that's been my experience, and what I think all the science is really mounting. The meditation, the breath work, all these different things, the what's happening within the different aspects, how our body will shut down the immune system or the digestion or our creative faculties when we're so stressed. I mean, all these signs are pointing towards we're not able to handle situations when we're not in that place as well. So for me, it feels better and it's practical.
Yeah. Yeah.
Wow.
And then I know we want to touch also on the study that was done for the Wim Hof Method, and actually have the study here, and I'd like to just read the title in one little section. So this is called the voluntary activation of the sympathetic nervous system. So again, that sympathetic nervous system is that more fight-flight response, that stress response. So voluntary activation of the sympathetic nervous system. So that's talking about that hormetic response where we're voluntarily activating the part of the nervous system that is the stress response, that adrenaline response. And attenuation of the innate immune response in humans. The innate immune response is what responds to pathogens or inflammation or stressors. So, significance, hitherto both the autonomic nervous system and innate immune system were regarded as systems that cannot be voluntarily influenced. So, before this study, it was very much the scientific perspective that can't voluntarily trigger an adrenaline response. You can't voluntarily trigger a reduction in inflammation. That's just not possible until this study. And the present study demonstrates that through practicing techniques learned in a short-term training program. So Wim put people through 10 days of training doing breathing, cold, mindset. So breathing, cold, mindset / commitment. 10 days. Then they did this study. Healthy volunteers practicing the learned techniques exhibited profound increases in production of anti-inflammatory mediators. So the study was they injected E. coli, which is a bacteria. It was already dead, but in the cell walls of bacteria is what's called lipopolysaccharide, or LPS, and that's an endotoxin. It's a toxic substance to the body. So people get sick when they've done this for more than 1,000 people. They inject them with dead E. coli, and this endotoxin makes them feel ill for hours or even days. And so what they did is, first Wim did the experiment where he had them inject him. He was doing his method and was able to not feel ill and was able to have a lower inflammatory response than all the other people. So then they thought, well, maybe he's an anomaly. He said, no, I want to train people and do this again. So he trained 12 people, 10 days. They went to pull into cold exposure, breathing, and mindset commitment with him. Then they traveled back to this university. They did this study and injected the dead E. coli and compared them to the controls who weren't doing the method. And during they were doing the breathing, when they got injected, they were doing the breathing method for over a couple of hours, and they found that the inflammatory response to that endotoxin went down dramatically. So interleukin 6, which is an inflammatory marker, was less in the people doing the Wim Hof method than the people who were not. Interleukin 8 was less. TNF alpha was less. These are inflammatory compounds that were lower. The cortisol went up quicker, and the epinephrine went up quicker. And then, interestingly, the cortisol came down and back to baseline earlier than the control group who wasn't doing the method. So they had, again, a hormetic stress response, a reduction in inflammation, and an earlier decline. They had an earlier rise in cortisol, that stress hormone, but an earlier decline in it as well. So again, a more, what we could say, maybe a robust stress response that dealt with the issue at hand, that helped reduce the inflammation, and then that calmed down earlier. And the symptoms were much, much less. The people who did the method were able to have minimal to no symptoms, whereas the people who did not had significant symptoms.
Right.
So
it's extraordinary.
Yeah, so it's an amazing study, and again, there's a lot, it's still a small study, there's a lot more to be learned, a lot more research that needs to be done, but it's something that I think could be, for me personally, it was a valuable thing to see that there is research on this method is one of the huge parts that attracted me to it personally. So I think there are a lot of people in that similar boat, that if there is some significant body of research there, it might be more impactful and they might be more drawn to that method.
It's wonderful. It's so empowering. It's something that's free, built on science. Obviously more science needs to be done to find out the nuances of it, but so much of the science. One thing that I think I'd like to share before we leave is that I don't have all the information here, but I do know that this has been already received, is that 3 of the scientists who have been working on the Wim Hof Method have won the Nobel Peace Prize recently. So all this stuff is mounting and growing and stacking upon each other in a way that really just empowers me and feels that it's so amazing that we have this option that we can do in our house, lying on our living room floor or in our bed, and then just turn on the cold shower that we all have access to. And of course, none of this stuff costs anything. The mind, the cold shower, and the breathing. It's like, it feels like, to me, it's a base level that we can build everything off of, So, is there any last things that you feel like would be good to share with everybody before we end this really awesome interview?
Yeah, I mean, of course, when I'm working with patients and they want to know more about some things they can do at home, and I'm talking about the Wim Hof Method, I'm sure to mention the app, which is free to download as a resource to learn. I also like to mention that it's not for people who are epileptic or people who are pregnant, and I also like to mention that the breathing should not be done driving a vehicle or in water, because people can get lightheaded, better laying down or sitting. And if people have serious medical conditions, to talk to their physician before doing the practice. That being said, for a majority of healthy individuals, this practice can be a fantastic way to reduce inflammation, a fantastic way to have that hormetic, adaptive stress response, kind of like exercise that, people should be moving their bodies. This is another method, another way to get that hormetic stress response, and specifically working with the hypothalamic pituitary adrenal response, the HPA axis, getting those adrenal hormones up and back down, up and back down. I think we need, in this culture, in this society today, we need much more attention to stress and stress management. We need practices like meditation and breath work and other methods or ways for people to be able to begin to have a sense that they're at peace internally most of the time. And, for people who don't feel that way, who don't feel complete in themselves and like their life is a devotion to other people because they're so good internally themselves. For me, it began with meditation practice, the Shungjen meditation practice, within a few months of doing that practice, I got to this point feeling like, gosh, I have everything that I need for myself. Now how can I help the world? How can I help others? We need more people to find that in themselves and to devote and dedicate their lives to serving and helping others. And I think that's where society can come together, to start to work together as one human family to protect the earth, to help each other, to end things like the chronic disease epidemic, to solve the problems isn't necessarily going to happen if people are just struggling to get by day to day.
Right.
So I really encourage that people find whatever tools, techniques, methods, practices, and or care from something like a good functional medicine provider, anything that would help them to feel like they get to a level where they're not just focused on getting by themselves, but they have freed up parts of their consciousness, their energy, their motivation in order to devote towards passion projects that are going to give back to the world, be it art or music or writing a blog or doing videos or offering something to the world that they feel passionate and inspired about. I want to see more people doing that, more people living their purpose. And whatever tool helps with that, I really want to support. So I support Wim Hof Method, and I believe that that can be really helpful for people. I support many other methods as well, in particular functional medicine, Shungjen meditation, exercise, of course, good sleep, good diet, things that people I think know that they should be doing but don't always do. This is a tool that maybe some people don't even know about, so it's great to educate and inform people about this. So thank you for putting together this platform to get this message out. And thank you to everyone who's watching for participating in this process, this interview, learning more about some things that you can do practically in your own life in order to help give yourself an adaptive stress response that's going to be something that can help lead towards feeling at peace, feeling connected with love, able to serve and support others. So thank you all so much.
Well, for everybody that would like to know more about your work and would like to know more about what you have to offer, what would be the best places for them to get into contact with you or find more info on you?
Sure. Yeah, thanks for that. So medicinewithheart.com is where our clinic websites for people who are looking to work with us in our clinic. That's the general public, and we offer functional medicine in that clinic. So, and we do work with people across the world, and in particular across the US is very easy to get all the lab testing and the supplements and things that we need, plus do virtual consultation. So we're set up for that, and medicinewithheart.com is the best place to go for that. And then for practitioners, for doctors, for clinicians who are working in some healthcare capacity, a supportive role, or who are treating patients, then institute.functionalmedicine.com or institute.medicinewithheart.com or mindbodyfunctionalmedicine.com are the places for practitioners, doctors to go to check out our program for educating about functional medicine for clinicians and doctors. And then of course connect with us on social media, Facebook, or Medicine with Heart is our page there. And then also signing up for some of the we do webinars, we do things that we educate the public, we have a blog on the website, we have a lot of free content, so if people just want to learn more, then the website and social media are the best channels to connect with the blogs that go out and some of the videos that go out in the webinar opportunities.
Thank you so much, Dr. Miles. This has been really an amazing pleasure and privilege for me, and I'm so excited for next time.
Thank you so much, Darien, and have a great day.
Yeah. Bye, you guys.